Among the 160 people attending this meeting are veteran emergency nurses, ICU nurses, PSWs, and other critical health care workers. Yet despite a dire staffing shortage across Ontario, none, not one, can get a job.
They say they were 66 short staff on the weekend. 66, and here we are readily available.
This video came out from CTV News, and I was actually shocked. I was like, wow, CTV News actually doing journalism? This is crazy. So let's watch.
Yet despite a dire staffing shortage across Ontario, none, not one, can get a job.
They say they were 66 short staff on the weekend. 66, and here we are readily available.
Despite working through the early pandemic, they were fired, most of them a year or more ago, for choosing not to get 2 COVID vaccines.
Isn't that insane? Isn't that absolutely insane? You have all these doctors and nurses who still have not been rehired back to the hospitals that have huge shortages. Healthcare workers are, like, there's a huge shortage for healthcare workers, right? There's all these people, thousands of doctors and nurses across Ontario and across Canada ready to work, but they won't hire them because they still haven't gotten the experimental drug because they're unvaccinated. So that clearly shows this is not about healthcare. This is not about health and safety. It's about money. That's what it's about. It's because these people did not get the Pfizer product, right? So Pfizer didn't make that, that extra couple, $1 million, and they won't rehire them. That is disgusting.
But the Ontario Hospital Association continues to enforce vaccine mandates in its 140 hospitals, the only association in the country to do so.
The only association in all of Canada that still forces the vaccine mandate. Where's the logic? There's no logic. There never was logic. It's all bullshit. It's pathetic.
4 major pediatric hospitals in Ontario are sounding the alarm over a growing waiting list of children in need of surgery. They blame last month's surge of respiratory illness and a shortage of staff. Nearly 12,000 Ontario kids are currently awaiting surgery, half of them waiting longer than clinical recommendation.
So you have these children waiting for surgeries, right? Children waiting for surgeries, and we can't give them surgery because there's a huge healthcare staff shortage. And you have thousands of doctors and nurses waiting to be hired, and they still won't hire them. During the pandemic, they were heroes. They were praised as heroes. People used to put signs on their front lawn like, a hero lives here, and it was like a picture of a nurse. Still, these unvaccinated nurses are public enemy number one, right? Because they didn't take an experimental drug. Even though we know all the information we know today, the vaccine doesn't help with COVID, doesn't stop transmission, right? Doesn't stop the spread. You can still catch it. You can still go to the hospital. You can still die. And we know that there's possible side effects that affect your heart, and they still won't rehire these doctors and nurses. That is pathetic. So now we're going to have these little kids suffer and just wait there for God knows how long before they get their life-saving surgeries. But oh my God, the politicians of Canada, the Ontario Hospital Association, yes, they care so much about healthcare. They care about the citizens, right? They put all these commercials with like the nice background music. Oh, we're doing our part. Roll up your sleeve. Get vaccinated. Stay safe. Like, they don't care about your safety. They don't care about your health. This is a clear case of evidence. They don't give a damn about you. It's all about money, which is very pathetic.
Yet most provinces and territories, along with Ontario, dropped vaccine mandates a year ago.
They have served their purpose to protect us, and as any...
If anybody still listens to this guy, there's no hope for you. There's no hope for you.
Public health measure, they have to be removed in a timely manner.
What I find most hypocritical is that the facility that I was fired from is open to unvaccinated visitors to come in, unvaccinated family members. Why can I not go back to work unvaccinated?
Exactly. Makes no sense. Unvaccinated patients can come in. Unvaccinated families can come in and get treatment, but the workers can't be unvaccinated. Like, The math is not mathing, right? Not making any sense.
There are no official numbers on how many healthcare workers were fired or quit because of the policy.
Yeah, that's a key point. They don't want to count how many doctors and nurses were fired, but I can bet it's probably thousands. Probably thousands were fired.
This is just a fraction of healthcare workers that have been laid off or fired due to not getting the vaccine. And I'm sure more would have joined us if they could.
The Ontario Hospital Association didn't respond to multiple requests for interviews from CTV, but in a directive to its membership, officials wrote, COVID-19 vaccination policies within Ontario hospitals should remain in place, given that they offer the highest level of protection for patients and health workers.
Like still, they're pushing the lies. They are still pushing the lies in 2023. That is so pathetic. This association should be taken to court. They should be tried for something. For putting putting children at risk. These children are trying to get surgeries and they're like, "Oh, sorry kids, the workers, they got to be vaccinated. So you're just going to have to sit there for months and slowly die. Sorry, kid." Like, this is so dumb. They need to be tried for like treason or something.
This isn't about patient safety. Patient safety is compromised when you don't have workers on the front line dealing with heart attacks, dealing with illnesses.
Exactly. It's not about safety.
It doesn't make sense.
Now the province says it will import nurses from elsewhere to fill the gap.
So do nurses.
Oh God, not Dougie. Not Dougie. This damn tool. Oh my God, this guy. Holy. Oh man, I don't even know what to say at this point. Another classic sellout politician. Nothing new here. This guy is a big joke.
If you've been thinking of making Ontario your new home, now's the time.
Meanwhile, those terminated.
We have a huge shortage of healthcare workers. We're going to ignore the thousands that are right here, next door, waiting for a job, ready to work. We're going to look outside of Ontario. They're like, "Oh, where can we find healthcare workers?" Right? We can't find any. Where are they? Like they're right there. They're literally right beside you. No. We can't find them. We have to look outside of Ontario. Oh, these healthcare workers are so hard to find. Oh, sorry, kid, you're still waiting for your surgery? Too bad. Oh, man, where can we find these healthcare workers?
I'd say they've struggled financially ever since.
We don't count. I can't collect unemployment. I can't collect welfare. And we're just left out in the cold.
Like, there has to be a civil lawsuit here. They can't collect unemployment or welfare? What is this? What country is this? I thought this was a free country. I thought this was Canada. I thought we had veterans that died fighting for our rights and freedoms. And we have these politicians doing this garbage to healthcare workers that were literally saving people's lives. There needs to be some kind of civil lawsuit. There needs to be some kind of accountability. That is complete BS.
Both the Ontario and Canadian Nurses Union also declined comment as they are focusing on working conditions and wage caps, not vaccine mandates.
Oh, and it's crazy because when there was the freedom protest in Windsor, I actually went there on the ground. You know that freedom protest that our Prime Minister Justin Trudeau said was filled with like Nazis and racists and misogynists and people that hate Muslims and all that bullshit. I actually went there on the ground and interviewed people and actually talked to this extremely nice nurse. Let me show you the video.
Now, what do you do for a living and what brings you out here?
I was a registered nurse full-time for 17 years, and the reason that I'm out here today is I was booted out from my profession because of the mandate. I think it's completely unfair because we were able to have exemptions in the past without scrutiny, and now they're scrutinizing everybody's exemption, including like religious or like a conscious decision, or even medical decisions are being turned away from our physicians, and it's completely, in my humble opinion, very unethical.
She was a nurse for 17 years and she got fired. Dropped her like a sack of potatoes. They fired her because she didn't want to take an experimental drug. And she's still not rehired. That's terrible. That is disgusting. This is Canada. Hopefully we see change soon. This Ontario Hospital Association, I hope someone brings some kind of civil lawsuit against them. I would definitely support that lawsuit. What they're doing is criminal. Well, I guess only time will tell. Thank you guys for watching this video. I appreciate the support. The comments I've been getting are really nice. I really appreciate all that. If you like what you see, please subscribe, please like, please share these videos. I'm trying to grow the channel so we can spread awareness, spread the truth, and get more people to think free. See ya.